fly in here, man. But hey, Big Money Bound TV, RT Posse, welcome back. Thanks for tuning in, man. Big Money Bound TV. Check me out. Today what we're talking about is floor therapy as a respiratory therapist. Floor care. Because I'm assuming that everybody just thinks, oh, respiratory is easy, because all they see is a floor therapist just putting on a breathing treatment, documenting, and running off. But floor therapists actually work the hardest. Floor therapy is actually more consistent work than any department. They're gonna work. A floor therapist is gonna work harder than anybody that's in the unit, any therapist that's in the ER, any therapist that's anywhere. Floor therapy therapists work the hardest, man. So all this, all they do is floor therapy. Floor therapy is easy. This, hey, man, hey, tone it down, man. Tone it down. That's what everybody assumes. Oh, I just see them on the floor walking around, typing something, putting the mask on, listening to breath sounds, and that's it. But you don't know what goes on behind the scenes, man. It's therapists that work in a unit. That they may just work in a unit. At my department, at my hospital, it's a little different in my department. They'll rotate you. You get rotated. Most of the people get rotated. Most of the people get rotated to floor therapy, units, ER, all that stuff. So there's no just floor therapists for the most part. But it may be some unit therapists who just work in a unit who prefer just the unit. Oh, they assuming, oh, you're a floor therapist, you're not working hard as me, I'm working the hardest. It's until that therapist that's used to being in the unit goes on the floors. First shift, first day as a floor therapist, they may be fine with it. Oh, this is no problem, this is easy. Now that second day, that third day, they like, hold on now, man. This is busy as hell. Exactly. Things you gotta deal with as a floor therapist, man. First things first, off the rip. They're giving you like your first rounds, man. That's when you're gonna have the most treatments. Your first round, you may have like one. In my department, man, you got at least 19 patients to see. 19 treatments to give, at least. I don't been so high as I don't been in the 25s. That's a lot of treatments to go around giving, man. So that's your 8 o'clock treatments, and that's your 10 o'clock treatments. I'm not counting the 10 o'clock treatments as double when they're like Duoneb and Pulmicort. Those are 2, but we count that as 1 patient. So you're giving more than 25 treatments. That's floor therapy. Now you in the unit, you doing your vent checks, you doing your breath sounds, you giving your breathing treatments. You're not gonna have no 25 patients to see, because you got vents. So they're not gonna give you that many patients if you have vents, because that's more critical thinking. You can't be one therapist to 18, 15, 16 ventilators. So that's why the floor therapist is actually working harder than the unit therapist. But the unit therapist may assume, oh, I'm dealing with vents. You're doing your vent checks, dog. You checking off what you see on the vent, man. Now if something goes wrong, your critical thinking comes in. Okay, you're doing more critical thinking. But I won't really say that you're working harder and we just putting down the floor therapist. Come on, man. This all goes hand in hand, man. Floor therapy, unit therapy, ER therapy. We all gotta stay together. Let's stay committed now. Now the floor therapist, man. Like I said, you're going out there with 19, 20, 22 patients to see. And you gotta like, prioritizing is a must, man. You gotta prioritize these things. You gotta look at which floor got the most 8 o'clock treatments, which floor got the most 10 o'clock treatments. You may have to start from this side of the hospital and work your way down and come on back to this side, because that's where the most 10 o'clock side. So you gotta really be strategic with your planning to really get all those treatments done in a timely fashion. Another thing is, we're not adding in the nurses calling you, hey, can you give bed such and such a breathing treatment? Their oxygen is low. Now as a new therapist, okay, no problem, I'll be there. Which is what I did. Had me running back and forth going crazy. But as a more experienced therapist, okay, you say they're having trouble breathing, shortness of breath? Okay, cool. What's their saturations? See? You don't even know your patient's saturations. I'm believing you just messing around, man. So let's assume that they say the saturations are 90. Yeah, the saturations are 90. Is the patient on oxygen? No. Well, you might want to give them some oxygen, man. Let's give them some oxygen and see what happens. You having trouble breathing? Let's give oxygen. This ain't just call respiratory therapy for breathing treatments. It's magical albuterol. Come on, man. You gotta think this stuff through. Like, it's not that hard, man. But I guess it's easy for me to say because I'm a therapist. From a nursing point of view, you may just be thinking low sats, breathing treatment, or whatever. I don't know. So now, from anytime a nurse calls me, patient needs a breathing treatment. All right, I gotta see what's the prioritization. What's the reason why? The patient says he's having trouble breathing. The patient said that? No, the patient said he can't breathe. He said but in order to talk, you gotta be able to breathe. Okay, no problem, cool. All right, what's the patient's saturations? 99. What's his respiratory rate? 16. Tell him I'll be there as soon as I can. So you know that's not something that's emergent that you got to go to right away. 99 sats, normal respiratory rate. This patient just wants a treatment. He'll get it. But I got to prioritize my situation that's going on right now. Now, sometimes a nurse may call you, patient having labored breathing. I got him on a non-rebreather mask. Saturations are only 92, 93. All right, so non-rebreather mask, that's 100% oxygen. You should be a little higher than 93, 92. So you want to hurry up and go and assess that patient. You come into the patient room, patient's wheezing. Okay, they do need a breathing treatment to create some bronchial dilation. But it's just things you learn as you go. So you got to deal with phone calls from nurses calling you. Sometimes it's just nonsense. The patient is requesting a treatment. He said he can't have one. He can't go to sleep without having one. All right, you got to put him at the back of the list. So he gonna get him. He going to the back, man. Okay, then you got nurses calling you saying things like, oh, this guy he wasn't giving his breathing treatment at 3 o'clock in the afternoon. Do you know what happened? It's 10:55 at night right now, man. 3 o'clock in the afternoon, I was at home sleeping. How could I know what happened? No, I know. He wants that breathing treatment. It's almost the next day. But you still got to address those situations. So that's why I never look down on a floor therapist. Because at the end of the day, we all respiratory therapists, man. You get cold blues on the floor, you got to know what you're doing. You get rapid response on the floor, you got to know what you're doing, man. We all therapists. I'm not saying one is easier, but every now and then, it is good to like change. And sometimes it's good for the floor therapist to go to the unit. That may be a load off for them. They used to having 20, 15, 18 patients. Now they just got 9 vents. Okay, cool. I got 9 vents. I'm used to having 29 people out there. So I can manage that. So it's good to just switch, switch it up. So, floor therapy, critical care therapy, ER therapy. We all working very hard, man. So, in my opinion, neither one is easier. It's just how you look at it and what you believe and make yourself believe, oh, I'm working harder than this therapist is. Hey, man. We all doing respiratory therapy, man. We all dealing with certain situations, man. There's certain things in the unit that the therapist is dealing with that the person on the floor isn't dealing with, and vice versa. We all working hard, man. We gotta stay here now. RT Posse, don't break on me. I know you see we got Nicki Minaj right there with the BMB over there. You know you see, and she counting the Fetty. How you love that, man? Big Money Bound TV, more videos coming.